Hi, I'm Matt Dioria. I'm the CEO of the Healthcare Consultancy Group, a global leader in medical communications. HCG is a network of interconnected scientific agencies that include Health Science Communications, Chameleon, Lumen Value and Access, ProEd Communications, ProEd Regulatory, Synergy, and the Scianomics Group. We are also empowered by a world-class core of digital, creative, and innovation experts at the HCG Engagement Group. I'm pleased to be with a team from the Health Science Communications team at HSC today to answer some questions for their group to get to know me a little better. Sure. So, from a personal standpoint, I'm married to the most wonderful woman in the world. I'm a dad of a bright and very energetic 6-year-old. I'm really family focused and happiest when I'm around my family. This week, I've got a bunch of family in town, and we're all headed down to a beach house together for a celebration of my parents' anniversary. I'm excited for that. That's kind of me at my happiest and in my element. As CEO, I feel like I have two really important functions. I think the first is to make sure that we are an organization that stays very focused on employee engagement and maintaining a really great culture. HCG is enjoying a tremendous period of growth, and I think continuing to cultivate our teams, making sure that the growth that we have as a company is translating into opportunities for all of those that are doing such amazing work is critically important. So it's a privilege to lead over 1,000 employees, but it's also an obligation. We need to make sure that people are engaged and challenged and growing in the roles. We need to make sure that they understand the significance of their work to our success and their work to bringing our clients' medicines closer to patients. And there's also an obligation for us to ensure that their jobs are stable and safe. And that kind of brings me to the second primary responsibility that I feel as our CEO, which is to make sure that we're changing, to make sure that our organization continues to evolve, improve, and get better. The world around us and particularly our industry, it's changing so quickly. I feel like what HCG represents is a common set of values. And the principal value within that is just the centricity to the engagement of our people. Like a lot of companies really lead with the work and the client, and I think HCG has taken a different path, and I think we lead with our people, and trust that that orientation to our people is going to lead to great work, and it's going to lead to happy clients. It's going to lead to to profits. But I think it's a function of our commitment to employee engagement and really being an employee centric organization that I think is what sets us apart. And I think that transcends through to each of the individual cultures of the agencies that are part of the group. I think we looked inward, and I think we shared quite a bit. I think I just think back to the position we were in April and May of 2020, and there's no playbook for the types of challenges that were being thrown at us. I think what I was really proud of is the way that our teams came together. They shared what was working. They shared what how they were approaching different challenges, whether that was with some of the challenges that we had to adapt to how we work, or some of the challenges that we were encountering in terms of being able to meet client needs in a really dynamic environment. So I am really proud of the way that teams came together and shared. And I think we're a lot stronger for that now. It's not as though we weren't connected prior to COVID, but the level of sharing and the insights that I think we started to exchange as a result of all of us looking for answers together. HCG is a leader in medical communications, and some of the efforts that you've referenced with respect to our thought leadership in the marketplace, whether that's some of the symposia that we've done, some of the webinars and thought leadership pieces that we've published. I referenced how quickly things are changing, and our clients need support. They need to better understand how things like omni-channel can be applied to our med ed space. There's a lot of and importantly so, focus on addressing health inequalities, and how can we leverage some of the insights and data sets and ability to communicate to HCPs differentially to address some of the social determinants of health that are part of health inequality. And so I think putting ourselves out there, sharing our thinking, sharing the work that we are doing, and the journey we're on is a good policy for us, and that I think it supports the transformation of our industry as a whole. And provides some insight into how we think and the direction that we're taking things. Well, candidly, I think the demand for our services is going to continue to be greater than the supply of talent in the marketplace. And so, principally, I'm focused on making sure that HCG is a destination for talent, that the best talent in medical communications wants to be a part of our agencies and our group. That begins first and foremost with retaining the people that are here and making sure that they're continuing to develop and be challenged in new ways and find their next career opportunities here at HCG. It involves being creative with the onboarding of people into our organization, even those that may not have a tremendous depth of experience in medical communications. And so some of the things that we've done with our new hire academy are oriented to helping with that. Just as we've always talked about safety and efficacy, and those have been the data points that and substance for medical communications for decades. I think we're already integrating aspects of value and value messaging into our work. I think that's going to increase, and I would also say that real world evidence and the application of the therapies that we're working with outside of the clinical trial in real patient populations is going to be something that our audiences are going to want to better understand. That's going to create a demand for more real world evidence data and the ability to articulate it. And so the investment that we've made over the past couple of years in founding Lumen Value and Access, I think is an important one for our group. I think Lumen is going to be represent a really important strategic part of the group with respect to that core discipline expertise in HEOR and real world evidence. And they're also going to be an amazing partner for our existing MedComms business, and that we're going to need to incorporate those endpoints and that language and that real world evidence into the content that we're building and deploying. We did a workshop towards the beginning part of the year called Futurum, and we identified 5 core drivers of change that we wanted to prioritize for HCG. And you've cited two that I haven't yet mentioned. I think lends itself as a solution to just the explosion of data. AI has the ability to help us to sort through that data, identify it, and purpose it for use. AI I think, is going to be a really powerful tool to empower our teams in the generation of their content. I think we're a long way away from the days of AI ever replacing any of the roles within HCG, but I could certainly see a lot of the roles within HCG leveraging AI to generate insights, to distill data sets down faster, to be able to do your work in a better and faster way. So just as the calculator and the spreadsheet replaced the slide ruler and the abacus, I think you're going to see AI become a tool that is going to be really integrated into businesses moving forward, and that ours will be no exception. So we have a group that is exploring that, looking at different use cases for AI, and seeing how we could use it for our benefit and for our clients' benefits. The metaverse, I think, is another really interesting one, and we have a team that is focused there. Obviously, through the past several years, we've all become much more accustomed to meeting virtually, but there are things that still feel a little different when you're in person. And my experiences in the metaverse thus far are that it gets you a little bit closer to that real world experience of being able to sit around a conference table with someone, for example. And so I'm excited for, again, our continued exploration of that. And potentially bringing some of the deliverables that we create for medical communications into the metaverse. So I think we've done things like virtual Congress booths as a result of COVID disruptions. I think you'll start to see those things incorporate the metaverse in a much more substantial way over the next several years, and I'm excited for that. Ultimately, what I want them to feel is that we're recruiting them for a career here. That we're hiring them not just for the job that we're looking to fill, but the one that we want them to do beyond that, and the one beyond that. And that we're a company that's really invested in the continued growth and development of our people. We grow through our people's growth, and I would hope that commitment feels different to them as they as they speak with us, and as they experience the people from around our group that have been have had that experience in their career, and are now looking to pay that forward and bring others into our organization in the same capacity. So I would hope that they'd be looking not just at the immediate job description and team that they would be working within. Provides a bit of a surrogate in terms of me to connect with others, and hopefully for them to connect with me in a more personal way. So I thank you for the questions that you've asked today, and the opportunity to speak with you.